Hello, my name is Emily Bridge. I use she, her pronouns, and I'm working on a project called Archaeology of COVID in Public Places within Metro Vancouver. This project is directed by archaeology professor Bob Muckle and funded by Capilano University. Both myself and another student, Jadzia Porter, are working on this project as research assistants. In another video, I go into a bit more depth about what this project is and why the work we're doing is important. But in this video, I will discuss some of our preliminary findings and questions we have for further research. What we are doing is using archaeological methods of study to make inferences about how inequality affects the human response to trauma, specifically that of the novel coronavirus COVID-19 pandemic. To do this, we are looking at two different areas of Metro Vancouver, including the downtown east side, which is within the city of Vancouver, and the North Shore, which consists of the city and district of North Vancouver, as well as the district of West Vancouver. These two areas make up one of the poorest and one of the wealthiest areas in Canada, respectively. We have been collecting data on COVID-related art, artifacts, and structures, and each category has led to unique and interesting findings. To date, we have documented approximately 1,000 artifacts, but this sample size is fairly small as we have been focused on public places, including parks, streets, and sidewalks in both commercial and residential areas. Art is one of the most temporary phenomena that we've documented. In this category, we've seen graffiti, murals, painted pebbles, children's art, sidewalk art, just to name a few. And already in this period of data collection, we've seen art and graffiti come and go, especially murals and these kinds of things, which are often painted over or covered up. The art also varies by community. In the downtown east side, we're more likely to find graffiti and murals that say something important about COVID-19 or about the public response. While in North Vancouver and in the North Shore, we're more likely to find children's art, inspiring messages in windows and painted pebbles in parks and along sidewalks. There is more visible evidence of COVID denial in the downtown east side as well, and to a lesser degree, the less affluent areas of the North Shore. Most of the structures that we've seen are signs, although within this category we also have barriers and sanitizing stations. In public places, the most common type of signage are those produced by governments or other public institutions, and many of these signs were installed in spring of 2020, and so they're now dirty, knocked askew, flipped around, or broken, lying on the ground and now becoming trash themselves. Signs that have been in place for months on end are unlikely to prompt rereading or further reflection, and so we wonder how much these signs are actually influencing public behavior. The majority of the artifacts we've found are discarded masks, although artifacts include gloves and sanitizing wipes as well. No matter what neighborhood we visit, we are going to find discarded masks, but we're more likely to find cloth or reusable masks in the wealthier areas of the North Shore compared to the downtown east side. The other interesting thing about masks is the number of them that we've seen hanging. Cloth and single-use masks on lampposts, on fences, in parks, and we're wondering why. For a cloth or reusable mask, we can infer that it's been hung up in the hopes that the owner will come back and claim it. But the hanging of single-use masks is a bit of a mystery. Is it that, they didn't want to dispose of the mask properly, and it feels better to leave it hanging up than on the ground? Or is this some kind of protest or statement about wearing masks? These are questions that we still have. The other important thing about masks, of course, is the sheer environmental impact that the number of disposable masks that we're using will have. The blue surgical masks that you see everywhere are primarily plastic, and as they break down and disintegrate, very slowly I'll add, those microplastics make their way into our water supply and eventually into the oceans. Scientists are already studying these impacts, but we won't know really what we're dealing with for many years to come. These are just a few of our preliminary findings. Research and data collection are ongoing. We know that studying the impact of COVID-19 will be a focus for social scientists and scientists alike for many years to come. We hope that the documentation that we are collecting now will contribute something meaningful to studies and to researchers as they continue this work. Thank you for watching.